Now over to Molly to begin.
Thanks, Dan, and hello, everyone. Thank you so much for attending today's Learning Community What's Ahead webinar for the Enhancing Oncology model. We're going to be sharing the link for today's slides in the chat. The slides include additional resources and links related to today's webinar and the model. To ask questions throughout today's webinar, please use the Zoom Q&A function. The learning system team and our guest speakers will answer as many questions as time allows. If your question is not answered live today, please visit EOM Connect Chatter. The answers to your questions will be posted via Connect Chatter. We can go to the next slide and cover the agenda. Wonderful. So for today's agenda, we're going to start by hearing opening remarks from the director of the Learning and Diffusion Group at CMMI, Kate Davidson. We're then going to provide an overview of the learning system and an overview of EOM participants' collaboration within the learning system. We will then hear remarks from an OCM oncology care model participant on why they are excited to participate in EOM. We will also hear remarks from a primary care first participant on their engagement and experience in PCF huddles and groups. We will then have an opportunity to ask our speakers questions during a Q&A session. Again, to ask questions, please use the question function in the Zoom platform. And finally, we will review important dates and some contacts. So with that, Shirley, I will pass it over to you.
Thank you, Molly. Good afternoon, everyone. At this time, it's my pleasure to introduce Kate Davidson. Kate is the director of the Learning and Diffusion Group at the CMS Innovation Center. Kate, please.
Thanks so much, Shirley. I'm so glad to be here today. As Shirley said, my name is Kate Davidson, and I'm the director of the Learning and Diffusion Group at the CMS Innovation Center. On behalf of my team and the Division of Model Learning Systems, I'm proud to welcome you to the model and the EOM learning community. EOM is intended to transform cancer care, reduce spending, and improve quality of care. The model is designed to test how best to place cancer patients at the center of high-value, equitable, evidence-based care. There are 44 practices in over 550 sites of care, representing approximately 34 states participating in the model, which began on July 1st. And we're all part of an even bigger movement, as EOM supports President Biden's Cancer Moonshot Initiative to improve the experience of people and their families living with and surviving cancer. EOM aligns with the Cancer Moonshot pillars and priorities of supporting patients, caregivers, and survivors, learning from all patients, targeting the right treatments for the right patients, and addressing inequities. Learning systems at the CMS Innovation Center are designed to support you, the practices who are on the front lines, testing innovations in cancer care to achieve success in the model and improve health outcomes. We know that innovation in care delivery happens locally, and relationships are key to improving patient care and experience. With that in mind, we look forward to building a relationship with all of you so that we can learn from you about what works and to create an environment to scale those best practices across the country so that all Americans have access to the pioneering ways that you are transforming care. Enhancing the care delivery system takes innovation, new ideas, and new applications to improve outcomes and better control costs. The learning system will evolve over time, just as your practices will evolve, to reflect new understandings of what drives meaningful change. We will serve as your partner in exploring new approaches and responding to challenges over the life of the model. Thank you so much for joining us today. We look forward to learning from you today and in the future. And with that, I'm going to hand the mic back over to Molly.
Wonderful. Thank you so much, Kate. We can go ahead and flip to the next slide. Great. So now it is my pleasure to introduce our speakers that will be presenting today. So we can go to the next slide. Today we will have Shirley Fung from our EOM Learning System Lead from CMS Innovation Center. We also have Hannah Dorr, our Learning System Lead Contractor. We have Dr. Susan Escudero, Vice President for Value-Based Care at Texas Oncology. Lisa Pearson, the Director for Value-Based Care at Texas Oncology. And Dr. Ritu Suri, Geriatrician Palliative Care Physician in Primary Care First, Group 3. With that, I will pass it back to Shirley.
Thank you so much, Molly. Well, we are really excited to have you all join the EOM learning community. The EOM learning system aims to support and help you to become more successful in achieving 4 goals. If you move to the next slide. So the 4 goals for the learning systems are: 1 is to capture care delivery improvements that you make throughout the model and share back our learning with you so that you know what others are working on. It fosters a deeper collaboration with your peers to share lessons learned and promising practices. It brings new research and expertise from industry leaders who have a lot of research and clinical practice experience in a specialized area. And it also disseminates successful care delivery interventions and their how-to implementation. Next slide, please. The operating principles of the learning system are all built around these 4 goals that we just looked at. There are 5 operating principles for the learning system, but I want to highlight 3 of them. First, it's outcome focused, which means learning events and activities will be aligned with model aims and the key drivers for change. The EOM key drivers for change document is available in the Connect library. Secondly, it is practice-centered, which means the learning system is centered around you. You will be connected with your peers through group-based learning, webinars, web-based Connect platform, and other opportunities to have an open exchange of ideas and innovations. Thirdly, the learning system is also evidence-based, which means CMS will identify and disseminate successful delivery system changes and strategies adopted by high performers in the model so that other practices could consider, adapt, and test within their own context. Next slide, please. There are 3 important tactical features that help us achieve the strategic goals of the EOM learning system. First, it captures care delivery strategies and tactics that you make through the model, and the system leverages this data to identify best practices and successful care delivery changes. We use a variety of learning modalities, such as the PTP survey, affinity groups, and webinars, to both capture and share back with you what you're working on to improve care delivery. Secondly, it facilitates ongoing peer-to-peer learning and supports authentic relationship building and sharing in a small group setting. And it also disseminates new insights and best practices through case studies, innovation spotlights, and webinars with industry leaders. So we're very much looking forward to building this community with and for you, and cannot wait to highlight all of the amazing care delivery improvements that you all will make and the impact of delivery system changes on patients, providers, and the health system. With that, I will pass it over to Hannah.
Great. Thanks, Shirley. Can we go to the next slide? I think we can actually go another one, and then one more. Okay, perfect. Thank you. So one of the ways the learning community will identify best practices and new insights is through the Participant Transformation Plan, or PTP survey. And this is a care delivery survey that will be delivered twice a year to gather key insights and activities that will inform our planning and development for learning activities so that they're geared towards assisting your organization in achieving model goals. So the survey feedback will also allow participants to compare care delivery implementation against your peers. So thank you all so much for filling out the most recent PTP survey. Everyone filled it out, and it will give us so much information to help build the learning community around your needs and goals in EOM. So we're still in the process of processing those results from that survey, and we'll share them when they are available. Can we go to the next slide? Great. So we just want to highlight that we do very much look at the survey data and that we use it to help you. So this is an example purely illustrative of how we may use the data in EOM. So using the OCM PTP survey data, we can kind of see what this will look like. So through the OCM PTP survey, we identified tactics that had either a high percentage increase in adoption or widespread adoption in OCM. So you can see there's a high increase in adoption and widespread adoption of tactics used to ensure 24/7 access to care and proper and timely referral and ensure timely follow-up on ED visits or hospitalization. So this is what something like this might look like. We can use, this data to identify strategies or tactics to kind of share across folks and kind of understand, what's going well. If we can go to the next slide. So again, illustrating from OCM, the PTP survey can also identify tactics that have not been widespread and have an opportunity to be expanded. So for example, in the OCM survey, we also have seen a high percentage increase in a wide range of tactical activities implemented to address patient-centered care, such as targeted care management, symptom management, comprehensive medication management, shared decision-making, and evidence-based practices using a clinical decision support system. However, most areas except comprehensive medication management still have room for growth. So areas like risk stratification, symptom management, and shared decision-making, and CDSS integration are potential opportunities for consideration in EOM. So just, kind of working off what this might look like in EOM, based on our PTP survey, we might be able to identify areas or opportunities, that we can kind of help support. If we can go to the next slide. Great. So another kind of tool that we have to use, so driver diagrams, and a driver diagram or key drivers for change is a great tool to help guide collaboration within the learning community and help everyone move towards the same goal. So reading the driver diagram from left to right, it tells us our collective aim and goals in EOM, while reading the driver diagram from right to left, it gives you ideas on how to impact this goal. You'll be seeing more of the driver diagram or key drivers for change throughout the life cycle of the model to help guide your EOM goals. So just wanted to kind of show that here and just give you all a preview of kind of one of the tools that we might be working with. We can go to the next slide. Great. So coming this fall, we'll be providing practices with a reference tool and framework for action called Change Ideas. And this resource is best used in conjunction with the EOM driver diagram. The Change Ideas are meant to serve as a starting point as you plan for your own care delivery activities to impact clinical outcomes, improve patient experience, and reduce medical expenditures. The Change Ideas break down the secondary drivers into strategies that provide a plan of action to achieve the overall model aim, and tactics, which are the actions and activities that could get us to the desired outcomes. This resource will be a living document, augmented and refined over time based on your successes and lessons learned that can help your peers succeed in EOM and make an impact with care delivery activities. During our first Affinity group session in October, we'll have the opportunity to discuss specific change strategies and tactics or activities that you're using to plan or are using to impact your EOM goals. We can move to the next slide. Awesome. Great. So all of that's to say the learning community and events and resources will be based off your evolving needs. Through frequently asked questions, popular topics on Connect, and through feedback we receive from post-event surveys and polls, like the one displayed here, where we ask participants what was on the top of their minds in learning. We'll incorporate your needs into kind of our learning events and resources. For example, we've invited your peer, Texas Oncology, to share their practice experience in using data and analytics to drive quality improvement today. So later on in this event, you will hear from them, and we'll continue to incorporate your needs into learning events and resources. So definitely appreciate your input, and we'll continue to look for that throughout the model. And with that, I will pass it back to Shirley.
Thank you so much, Hannah. So now it is my pleasure to introduce Dr. Escudero and Lisa Pearson from Texas Oncology to discuss their experience as a participant in oncology care model and what they're looking forward to in EOM. Dr.
Okay.
Escudero and Lisa, please.
Thank you. Next slide, please. Thank you. So giving you a little history of Texas Oncology, we have about 200 practices across the whole state of Texas. More some, actually. We are one of the largest cancer treatment and research providers in Texas, specializing in hematology, pediatric, radiation oncology, and much, much more. As a pioneer in community-based cancer care, Texas Oncology's participation in OCM and now EOM is a perfect example to our commitment to leadership and innovation and improving overall patient care.
Well, the goals of OCM were to decrease the total cost of care while improving patient satisfaction and patient outcomes. So early initiatives included trying to help our practices devise ways to keep patients out of the hospital and out of the emergency room. So we instituted a number of programs, including virtual nurse navigators. We had a Call Us First initiative so that patients who are on chemotherapy would be given information cards and telling them, what to do if they had a symptom that was concerning, so they wouldn't just present in an emergency room. Along with this, we encouraged our clinics to have more openings for same-day visits, drop-in visits for sick patients, and things like that. We had a clinical pathway program, which actually preceded OCM, but tied in quite nicely. When this was a voluntary program, and the physician compliance was probably somewhere about 70%. We have in our practice an annual bonus, and when we tie the annual bonus to pathway compliance, amazingly, it's went up and stayed up over 90%. And this way we can encourage our physicians to use the evidence-based pathways, as mentioned earlier, but also to use the more cost-effective pathways. We do not expect people to be 100% compliant because not every patient is unique, every situation is unique, but for the vast majority of patients, the gold standard pathways are appropriate therapy. We had team huddles, and these in the clinic setting would typically be the office administrators, nursing, physician benefits coordinators, physicians, APPs, medical assistants. And these were great opportunities to identify patients who perhaps were having trouble getting things completed to get started on treatment, patients who were having trouble getting to their treatments or were having more complications. There were also huddles that were between practices, which were typically attended by practice administrators and nurse managers, where we would identify initiatives to improve our metrics, and then people would share how they were doing, what was working for them, what wasn't working. And that was actually a great format because people get, I think, a little bit competitive, so they want to make sure that their region is succeeding. So those were very nice, and people were able to brainstorm. We had a variant that I thought was quite interesting, where our value-based care staff came up with some scenarios about patients in a difficult situation, and they were brought up as, how could we do this differently? And how could we identify resources to help this patient manage better through their treatment? So we have continued these strategies, as well as our EPROs, electronic patient reported outcomes, and also increased our social work intervention. So I think a lot of the things we learned in OCM will continue and help us to succeed in EOM.
Wonderful. Thank you so much, Dr. Escudero and Lisa. I wanted to just pause for a moment here, allow some additional folks to ask questions using the Zoom Q&A function, but we will spend the next couple minutes here asking Texas Oncology some questions. And it looks like we have one that has come in through the chat. The first question is, how do you find the patients with high ER utilization?
So one of the things I think we're still struggling with is predictive models. And we do have some. We use something called Apex, and we use pain scores. And they are things that predict patients that are more likely to have hospital admissions and ED visits. Otherwise, it becomes more retrospective. So we find either from getting the feedback data from OCM that we had certain doctors or certain clinics that had a higher number of ED visits, and we would kind of try to do interventions with those clinics to try to intervene earlier. And then, but I do find one of the problems we have is most of the data we get is after the fact. You know, a patient comes back to clinic because even in my area where I'm in Houston, it's a big city. So my patients have like 5 or 10 hospital systems to go to. So I don't always know that they've gone to the hospital. So this is where we would try to identify people in the huddle to let the team know who had been admitted, either because the doctors knew about it or because the patient family are called in.
Thanks, Dr. Escudero. One other question that we just received: how did you choose between correct EPROs suitable for your practices? Excuse me.
I can't claim credit for that one. Deborah Pat was very involved with this, but we chose a platform that we judged could meet our patient needs the best. And then while we used it, we had to evolve the way we used it. So for example, when patients first started using it, the clinic was getting a notification for every symptom. So we very quickly transitioned to only having a nurse notification for moderate score or more. You know, so, and we also allowed the patients to push a button that said, need a call back, don't need a call back. You know, so for example, a chemo patient could quite conceivably be fatigued every day of their life, but they're not really feeling any worse, and they really don't want somebody bothering them at home, but they're letting us know what's going on.
Wonderful. Thanks, Dr. Escudero. I think this next question here, I will pass it over to the CMS EOM model team. The question is, when will we start receiving EOM data?
I can jump in. This is Eileen. We are expecting, oh, Claire, are you there?
Yeah, I'm here. Can you all hear me?
Go ahead. Yep. Yeah, there you are. Yep.
Yeah, so we can start looking at data for EOM next month in September. Early September, we'll be delivering the monthly claims data that will be through the EDFR, the same portal where participants received their historical claims data, and that will cover data for the month of July since the model has started, and we will communicate with you all when we have the exact date for when that will be shared. And then we also will be looking at sharing initial dashboards for EOM, which will include pre-model data a bit later in September. And again, that will be through the same portal that we shared the historical claims data through, and we'll communicate with you all on that as well. And finally, we're looking at sharing the quarterly feedback reports, which will include model data through the same portal starting in December of this year.
Thank you so much, Claire. So I think with that, we will go ahead and close out our Q&A section with Texas Oncology. I wanted to sincerely thank both Dr. Escudero and Lisa for speaking about their experience in OCM and sharing what they're excited for in EOM. And with that, I will go ahead and pass it back to Hannah.
Great, thanks, Molly. If we can go to the next slide. Awesome. So I want to kind of preview our group-based learning and sharing ideas. So during group-based learning, you'll have the opportunity to hear from your peers, just like some of the insights you just heard from Texas Oncology. It's a really great space for you all to connect and share any strategies, concerns, progress, whatever you want to talk about there. So it's an amazing place to collaborate with others participating in EOM that have, similar experiences. So we'll be launching group-based learning soon, and group-based learning drives engagement and sharing among model participants through meaningful segmentation of model participants into smaller groups, either as a longitudinal cohort or based on topic of mutual interest. So we'll be launching group-based learning to give you kind of some of that closer knit feeling, and you can all, connect on very similar issues. So this will be done through affinity groups that will meet quarterly, and you'll have the opportunity to connect with similar practices in the model, such as community-based hematology and oncology practices, community-based multi-specialty practices, or health system and hospital practices. And as I mentioned, these are designed to help you build your network and foster camaraderie. The other group-based learning opportunity will be topic-based huddles. These are more informal and ad hoc meetings that are designed to gather practices to discuss specific topics of interest from a previous webinar or affinity group, such as out-of-pocket costs, ePROS prep, or HRSN screening tools. Again, these will be kind of flexible and sort of based on your needs. If we can move to the next slide. Great. And the benefits of affinity groups are, you'll be invited to a private space on EOM Connect with other group members. You can talk to each other to share challenges, new ideas to tackle challenges, best practice in your clinics, and or bounce ideas off of each other. So this is in addition to kind of live events where you'll be able to kind of have that interaction, but between meetings, you'll also have the resource of Connect as well. You'll also have a dedicated point of contact from the EOM learning team, so you can kind of contact us between quarterly meetings as needed as well as a resource. Potential topics that we may discuss in affinity groups include ideas for addressing the secondary drivers in the driver diagram that we reviewed, reflections on the PTP survey results, recent tools or toolkits to improve care, research studies, upcoming EOM model milestones, and barriers to implementing change ideas. And again, this is not an exhaustive list. It will very much be based on specific needs that arise and anything that evolves throughout the model life cycle, but definitely some possibilities here. Great, and with that, I will pass it back to Shirley.
Thank you, Hannah. So now it's my pleasure to introduce Dr. Suri to share her experiences collaborating with other primary care first model participants through group-based learning, just like the ones that Hannah walked through with you. So Dr. Suri will share with you how Affinity Group actually works in action and the benefits from her participation. So Dr. Suri, take it away.
Thank you, everyone. It was wonderful to listen to everyone and all the speakers. Thank you. I still learned a lot. So I've been a practice that has been participating in CPC, which was the first model of value-based care. And then we chose to participate in primary care first. We are essentially a geriatric practice. So we are in risk category 3. So it tells you that we have patients who have intense needs and several comorbid illnesses. We serve patients in their homes, in assisted living, independent livings, office, and so it's a very diverse group of patients. I think it has been a wonderful journey for me personally, but to be participating in these models. But the best part of this really has been our group-based learning. When we were in CPC, we were actually meeting in person, but with PCF, we have not been able to meet a lot in person, but with our community connect that you have as part of your EOM. I actually haven't seen your model, but we have a connect where we can connect with different practices. And I will tell you that right from the beginning, being that it was a geriatric practice, risk stratification was very overwhelming for our practice because I felt like everybody belonged to group 5 and 6. And if I was using the AAFP model, every one of those patients needed care management services. But then, connecting with other groups and providers, I learned that there were other tools that I could use for risk stratification. So it made our lives a lot easier. Also, just learning what was the job title and what was the job of our care manager? What was she supposed to do? And like, what kind of questions were they supposed to ask? I think all of those things we learned together. So I know one of the presenters presented that call us first thing. We actually borrowed one of those posters because one of those practices had developed those poster, what was the appropriate care place for care, when should they be calling our office and coming to our office, and when they should be needing to use the urgent care, and when they should be going to the ER. And, so there was a poster that was developed by one of the practices that they shared in one of those huddles, and we actually adopted that. So I have to give that credit to them. And it really was very helpful because it helps patients, and it is a colorful poster. So it's in every exam room that we have. We circulated it through our email. It was on their portal. So it was actually really helpful. And, we actually, part of being a part of the American College of Physicians, actually did a QI project on our advanced care planning during COVID. And it was because we were all online, and we were able to share our model during one of the huddles. And I know that a lot of practices reached out to us afterwards and how to implement that model. So I think it is still collaborative. Some of these practices are in South Jersey, which, it's probably 50 miles away from me, but we still connect with each other and, even collaborating on how do you operationalize any new intervention. And one thing that I want to share with all the new participants is start small, because it does seem overwhelming when you get all this data thrown at you and you don't know how to and what to do with that data. So I would say start small, really small, and go ahead from that. And we actually had each other to talk to, so we were able to see what was working, what was not working, and then we were able to implement those things. So I'm happy to take any questions. I know it sounds like I am fairly advanced, but believe me, I'm learning every day. So
Thank you so much, Dr. Suri. It's wonderful to hear about your experience collaborating with other practices. At this time, we will take a second and answer any questions that you may have for Dr. Suri. Feel free to post using the Q&A function, and I'll just give it about 20 seconds to see if any questions come through. Okay. I'm seeing no questions at this point. But again, wanted to sincerely thank you, Dr. Suri, for sharing your experiences today. I think this is
welcome.
a great note. We did get a note in the Q&A. Love the ideas you leverage with Call Us First. We learned to use a refrigerator magnet because of sharing. Wonderful. Thanks, Deborah, for sharing. Okay, so with that, we can go ahead and move to the next slide. At this point, we're going to go ahead and launch a poll. This poll is intended to let you all know that we are inviting you all to participate in one of the following affinity groups. These affinity groups are going to meet quarterly. If you know at this time which group your practice would like to join, you can select that group now. If you do not know which group your practice is interested in joining at this time, there will be other opportunities to sign up through the e-news and through EOM Connect in September. The options that you all have for affinity groups right now will be community-based hematology and oncology, community-based multi-specialty, all hospital and health system hematology, oncology, and multi-specialty, and then, of course, an option for you all to decide later. So I'll give you just another minute here to respond to this poll, and we can go from there. Okay, I'm seeing the poll slow down just a bit, so I'll give it just another 10 or so seconds. Okay. Closing the poll now, and like I said, you all will have another opportunity to sign up for an affinity group in September through our e-news as well as EOM Connect. But for now, it looks like we have a lot of interest in the community-based hematology and oncology affinity group. There is some interest in community-based multi-specialty, and then as well as interest in all hospital and health system hematology, oncology, multi-specialty. So great to see that there is some interest amongst you all to participate in an affinity group. For those of you who did decide later, no worries at all. We will be in touch to have you all sign up if you'd like. Okay, at this point, we can go ahead and go to the next slide. I did just want to review some upcoming activities with you all. Next slide, please. Great. So coming up through September, like I mentioned, we will have our affinity group signups open through about September 16th. On September 29th, you all will have a deadline to implement PRAs and submit the PRA attestation and optional 2023 health equity plan, Moving into October, we will host an EOM dashboards webinar, and we will launch our provider and payer affinity groups. Those will continue into the end of the year. So you'll see some additional meetings for our affinity groups moving into November and December. And then later in the year, we also plan to have a webinar related to out-of-pocket costs that we will be following up with you all with some more information on. Next slide, please. Here, I've just provided some additional contact information for you all. I wanted to reiterate again, if you all have a question that was not answered today, please feel free to reach out to the EOM help desk at eom@cms.hhs.gov. You can also give the help desk a call. We've also included the EOM Connect site for you all to access, CMS on Twitter, as well as the EOM website. At this point, we have a question in the chat, so I'm going to go ahead and quickly pass it over to Shirley.
Oh, thank you, Molly. Thank you for that question. Technically, yes, but I do wanted to mention that there is a commitment for the affinity group. The affinity group, the purpose of it is really for the cohort of folks or practices to kind of like go along the model together for, 12 months or 18 months, or maybe even longer, depending on the members of the group on their decision whether to continue to move forward as a cohort, to learn and to grow and to share. Sometimes, even share challenges and share solutions. So if, you're practicing that you're able to, commit resources longitudinally to more than one affinity group, feel free to sign up more than one. But I think, there will be a lot of benefits in sticking with that one group for, a relatively longer period of time, so that you guys can really test out innovations and be able to see some preliminary results together. Yeah, so that would be the thought. Does that answer that question? Molly, I'll pass it back to you.
Thanks, Shirley. We can go ahead and move to the next slide, where I do just want to close out. And before that, I'd like to remind you all of several resources available to you, including today's presentation slides shared in the chat. As a reminder, you can find all of today's resources as well as resources from past events in the Connect library. Thank you so much for all of our speakers for today. Before we wrap up, I'd also like to note that when today's webinar ends, we'll be prompted to complete a brief survey, and we sincerely appreciate your feedback as we seek to improve our future events. That concludes our event for today. Thank you to everyone for joining and to all of our speakers, and again, for all you're doing to enhance oncology care. Have a wonderful rest of your day.